Hello, welcome back to Jack's journey post cruciate ligament surgery. So he had surgery on his left hind limb. Come and join us for the first week post surgery. So our first day post surgery, we started doing some gentle physio, and we were just taking him out to the toilet in the garden. So we began with some pulse mag on the acute pain setting to help control his pain. He was also on painkillers, so he was on gabapentin, Pardale and Metacam at the time as well. But we just did the pulse mag as well to help speed up the healing process and reduce the pain as much as we could for him because he is quite sensitive. Obviously, he was in his crate and he had to have his cone on. I've ended up in the cage with Jack so that we can ice his leg, haven't we? Yeah, you've been a good boy. You can't have the ice though. No, you can't have the ice. Thank you. So we're also icing his leg just to help reduce the swelling. As you can see, it wasn't really that swollen the first day after surgery, but as you'll see in the later clips throughout this video, it does get quite swollen, and that is totally normal. But if you use ice to reduce the swelling, it also helps to reduce the pain associated with that swelling. So we were just taking him out to the garden to go to the toilet. As you can see, he's not really putting the foot down at all, which is quite normal for first day after surgery. It is often worse than they were before surgery. So you can tell that he's not really putting any weight on that left hind limb at all, and he does also struggle to put the paw the correct way down, so he was knuckling it rather than placing it down correctly, but all totally normal for one day after surgery. So we weren't too concerned, we just wanted to make sure he wasn't doing too much and that he could go to the toilet comfortably. So our second day after surgery, quite similar to the first day. So for the first 5 days, there was quite a lot of swelling. You're still in that acute pain phase. So we were doing lots of ice, pulse mag on the acute pain setting, and some gentle passive range of motion. Unfortunately, I wasn't able to get any videos of that just because it's a little bit difficult doing it in the cage, but I got videos of everything else for you. So we were still icing his leg. I did sometimes do the ice on its own, sometimes the ice with the pulse mag. It doesn't really matter. But you can see the pulse mag there under his leg. That's on the acute pain setting again, and the ice on top of his leg to help reduce that swelling. The second day after surgery, we could also take his plaster off. You can see it's still in this clip. I have added some pictures of the wound, so if you don't want to see that, skip over this next part of the video. So this is what the wound looked like when we took the plaster off. You can see it's a little bit sore where they've shaved him. You can still see all the stitches. But we're quite happy with this because, as you see, there's no discharge, there's no bleeding, and it's healing quite nicely for only 2 days post. Again, we just took him out in the garden to go to the toilet. You can see that he is putting the leg down a little bit better this time. So he has a little bit more weight on that left hind leg. You can see it's starting to swell a little bit. It's getting a little bit thickened. We're all doing much better for 2 days after surgery. So day 3, again, fairly similar, but on day 3 we had a checkup at the vets. So we also went to the vets for them to have a look at the wound, have a see of how he was walking, and just basically check that we were getting on okay. So in the morning, we started off pulse magging his leg. You can see that he had a cover on his leg. We only used that for the first 3 days, just whilst that plaster was still on, and then until we got to see the vet, just to make sure that nothing was getting into the wound. So we set off to the vets. Unfortunately, he still had to wear his cone, even in the car, which he was a little bit sad about. You can tell he's not best impressed, but We got on okay at the vets. They were very happy with how he was doing. They gave us some suggestions of different cones we could try because he'd already learned how to push this one back so that he could reach round to his leg. When we got back from the vets, we took him for a little wander around the garden. He was getting a lot more comfortable on his leg here, and you can see he's actually starting to put it down and stand on it, which is really good. Unfortunately for us, he got a little bit overconfident and decided he was going to try and go down the step, which obviously he's not allowed to do steps, and we've been carrying him up and down the steps. I'll put a picture in of the step. It is only very small, thankfully, and it didn't do any damage, and he was absolutely fine. This is the step in question with my foot for, I guess, for, what's the word? Perspective, so that you can see how small the step actually is. But yeah, he was very naughty to try this step, so we had to make sure that he didn't do that again. Day 4, we got a delivery of a new cone to try with him. So I'll show you some pictures of that. So this was the cone setup that the nurse had recommended, to put the buster collar on below the cone to push the cone forward. However, we found that this didn't really work for him and he was still able to push it back. And because he's got such long legs, it didn't really stop him getting to the legs at all. So we were still icing his leg and we were still checking the wound every day. I'll put some more images of how the wound was doing because it starts to look a lot better. So even just a couple of days after surgery, you can see the difference. So all of the redness around the wound has now gone, and it's starting to scab over really nicely. We also needed to do some massage because, like I said, his leg was starting to swell. So we did some massage from his foot all the way up to his hip because the lymph node is in by the hip joint. So we were massaging up from his foot up to that lymph node to try and drain the fluid away from his leg. So normally we would always massage in the direction that the muscle goes, because when we're massaging for the muscles, we want to go in the direction of the muscles. But in this case, because we are massaging to help improve lymphatic flow and drainage to reduce that swelling, we go in the opposite direction, because if we were to massage down his leg, we'd just end up with lots of fluid in his foot. So instead, we massage up the leg and make sure that that fluid is going into the lymph system, down into the lymph node, and then it can be drained away. He was still going out in the garden for his toilet breaks, so we were doing 5 or 6 toilet breaks a day for him, just very short walks in the garden for those. You can see that he's starting to put some weight on that left leg now, but you can see just how swollen it's become, so we really had to keep on top of the ice and the massage. So day 5, it was starting to look a little bit better and you could see that the swelling was starting to reduce. He was definitely a lot happier and a lot more confident. So you can see here the swelling's not as bad, the wound's looking really good, and we had found a cone solution that worked for him. So we had decided to put on the plastic cone that the vets had given us with a soft cone over the top, and that helped to push the plastic cone forward. Because with just the soft cone, he figured out that he could bend that, and with just the plastic cone, he figured out that he could push the cone backwards. He was still going in the garden for his little walks. You can tell the swelling started to reduce on his leg. He's a lot happier. This was his last day of having gabapentin, so it was interesting to see how he was doing with that. So from day 6 onwards, he didn't have any more gabapentin. He had a couple more days of the Pardale, and he was still on antibiotics this whole week, just to make sure that the wound didn't get infected. We had a little bit of fun with his cones when we finally found one that fit. I decided to use the other one because I think at this point we were getting a little bit stir crazy. Obviously, we hadn't left him. We just stayed in the house with him and make sure he was okay. We hadn't slept particularly well because obviously he was a bit uncomfortable. So I think maybe here I was slightly losing my mind. But yeah, I mean, if you can't have a laugh, then what's the point? Day 6, again, he was feeling a lot better. He wasn't on the gabapentin anymore, which had been making him a little bit sleepy and also making him feel a little bit sick. So he was sleeping a lot better from day 6 onwards, which was really good. You can tell when I got him out of his cage, he's still toe touching on the left hind, but once he's out and he's had a bit of a shake and everything, he starts to put weight on it better. He was still just going out into the garden for his little walks. And you can see that he was starting to get a little bit more confident. He was starting to be a bit more his usual self, trying to look at things, see what's going on around him. So he was definitely doing a lot better by the time we got to day 6, and the swelling had reduced a lot. So we didn't have to do much more with the ice and the massage because it was really doing really well with the swelling. Day 7, and the last day that we're going to cover in this video. He was still going out into the garden for his little walks. As you can see, he was walking a lot better. Sometimes we would take him out with his cone on, sometimes we wouldn't, depending on the time of day and how long we were out, if he was going to be eating at the same time. So when he was just going out for a toilet break, we would leave his cone on just to make sure he didn't lick his leg or anything. And then if he was having food as well, we would take the cone off and he would stand in the kitchen and have his food to do a little bit of assisted standing just to help him load that leg a little bit better. And you can tell now, we're on day 7, he is able to stand with that leg on the floor and he's able to walk a lot better. So overall, we were really pleased with how he was doing only 1 week post-surgery.